Welcome back to hyper and hypothyroidism. Let's take a look at hyperthyroidism this time. Once you know one extreme, learning the opposite is going to be way easier. Hyperthyroidism is the overactivity of the thyroid gland causing too much T3 and T4 to be produced and released. Consequently, just like we talked about in that feedback loop, the pituitary gland produces less TSH to slow down the thyroid hormone production. So in hyperthyroidism, we can say that there are high amounts of T3 and T4 and low amounts of TSH because we don't need to stimulate that thyroid anymore. Now, what causes hyperthyroidism? Why would someone be diagnosed with this condition? The most common cause of hyperthyroidism is a condition called Graves' disease, an autoimmune disorder that stimulates the thyroid to release too much T3 and T4 hormones. Think you are cranking out so much T3 and T4 that you're getting the gains, baby. It is getting hot in your body. Other causes would be anything that affects that negative feedback loop. Excess iodine, remember, that is our key ingredient to making T3 and T4. Benign tumors of the thyroid gland can make too much thyroid hormone. And lastly, accidentally overusing levothyroxine in patients with hypothyroidism can stimulate too much T3 and T4 production. Signs and symptoms are high and hot because remember, those gains are pumping out T3 and T4. Remember that the thyroid controls metabolism to create energy for our body to maintain homeostasis. If we go above and beyond this normal function, we see high vital signs, high energy, fast metabolism, and high temperatures. For the NCLEX, remember the 2 G's, grape eyes and a goiter. I remember this by thinking of a man that is suffering from hyperthyroidism, has Graves' disease, getting the gains with his grape eyes and goiter. So we have hyperthyroidism. Now, how do we treat it? Because the patient is experiencing an overproduction of thyroid hormones, our goal is to decrease that production. We do this by giving anti-thyroid medications, which will stop the thyroid gland from making too much thyroid hormone. We have propylthiouracil, PTU, think puts the thyroid underground or suppresses its actions. Methimazole, think methy for the thyroid. And lastly, SSKI, aka potassium iodide, which shrinks the thyroid in preparation for a thyroidectomy. We can also give beta blockers as symptom control to slow down our heart rate and control that high blood pressure and heart rate we see in hyperthyroidism. Because the patient exhibits an overactive metabolism and high and hot symptoms, we want to encourage a diet that will replace those lost nutrients. We teach patients to eat frequent meals and foods high in calories, protein, and carbs. We also teach to avoid high fiber foods, caffeine, and spicy food. Why? This will encourage a faster metabolism and worsen hyperthyroidism. Another NCLEX tip, uncontrolled or untreated T3 and T4 levels can cause a thyroid storm. Think of this as when your heart rate, blood pressure, and body temperature rise to dangerously high levels, and this can be life-threatening. Just like myxedema coma, we want to watch for these symptoms and teach about proper medication adherence. And that's gonna wrap up hyper and hypothyroidism. I see you pausing this video, taking notes left and right. You don't need to do that. Everything you heard is available in study sheet form on my Etsy shop. Check it out.
I love it. That's great. That's
Woo! Yeah, like, subscribe, everything.